Hey, how you doing? Dr. Otto Geiseman with Structure Function Chiropractic here in Plymouth, Michigan. And I wanted to talk to you about what we're doing when we perform an adjustment or a chiropractic adjustment on the body and why we do it, okay? Typically what's been said is that, we need to align the spine. Well, current research kind of talks about it a little bit differently, and I kind of want to fill everybody in on what we're doing, what the goal, at least when I perform a chiropractic manipulation, what I am going to do, okay? And the first thing I'd like to say, what we're doing here is we're trying to open up what we call the facet joint. So I'm going to get a little bit closer here. Hopefully you guys can see pretty well. Okay, so the facet joints, you can see each one of these segments have a joint on one side and a joint on the other side, okay? And I'll open it up here so you can kind of see. Good, so that one's opening up a lot easier, so we'll go with that one there. So get a little bit closer, good. And you see that's what we're trying to do here. Now this has a capsule that surrounds it in the body and a lot of muscles that kind of go from each one of these points, different layers. It's, the way to think about it is, see how kind of spiky the bone is, but those are actually there for muscular attachment. So you can imagine how many muscles actually insert into the spine to create all the awesome movements that our body are able to do, okay? Now we're doing a manipulation. What we're attempting to do is we're trying to open what we call zygapophyseal joints or facet joints, those joints on the side we just discussed. What we're trying to do is open those or gap those, okay? Now, why we do that, okay? First of all, what we're doing is we're breaking up any adhesions or scar tissue that is formed within the capsule. What we find is that each segment should have a certain range of motion that it's capable of doing. But unfortunately, the way that we live our lives and we do the same repetitive tasks daily, especially if we have a job that requires it, a desk job or even a factory job, we tend to move in certain ways. And we have little micro injuries that occur, so we tend to move a lot in certain segments and very little. So hypermobile in the segments that we move a lot and hypomobile in the segments that we don't move enough, okay? So when I'm analyzing the bodies, but the spine, this also can be put to joints, the joints of the hip, the knee, etc. as well, but we'll focus on the spine today. But what I'm doing is I'm looking for those joints that tend to be moving too little and what joints are moving a little bit too much, okay? So we find a joint that's moving a little bit too little, we'll call that a hypomobile joint, it's not moving enough. My goal is to open that joint up so I can free up that range of motion, okay? The other thing that we're doing, besides breaking up that scar tissue by gapping that joints, is we're stimulating a large number of nerve endings in that area, okay? So each one of those, again, points, those little spiky points, have muscles that insert in there, and those muscles have these different receptors in the tendon that sense stretch, and the capsule around there has proprioceptive neurons. There's a lot of different nerve endings in those areas, and when we stimulate it really quick, we see a reflex in the spinal column, all the way to the spinal column, and the nerves that goes all the way up to the brain to the central nervous system that modulates pain. Okay, in turn, we see a reflexive relaxation, the muscle that surrounds that joint, and also an overall decrease in pain. Okay, so that's why we're doing the manipulations. We're trying to free up the joint so it's free to move through its full mobility. Okay, we're trying to decrease pain and decrease the tone of the muscles that surround that joint. Okay, now does that potentially create a more inline spine because we are decreasing the tonicity or the tension in those muscles that surround those? Absolutely. So you can look at it from that point of view. But now that we have kind of researched it further, what we can see exactly what we're doing is we're opening those joints, we're stimulating the nervous system to relax, we're decreasing pain and freeing up mobility. Okay, again, Dr. Otto Geiseman with Structure Function Chiropractic. Hope this cleared a few things up for you. Have a great day. Bye.